How does Ra affect red blood cell production? Have you ever wondered how rheumatoid arthritis, or Ra, impacts red blood cell production? This condition is more than just joint pain. It can also lead to anemia, a common complication for many living with Ra. The connection lies in chronic inflammation and how it disrupts the body's ability to produce red blood cells effectively. In Ra, the immune system is in overdrive, producing pro-inflammatory substances known as cytokines. These include tumor necrosis factor alpha, interleukin-1, and interleukin-6. These cytokines can interfere with erythropoiesis, which is the process of making red blood cells. They can increase the programmed cell death of precursor cells in the bone marrow, which are essential for producing red blood cells. This means fewer cells are available to mature into healthy red blood cells. Additionally, these inflammatory cytokines can suppress the bone marrow's response to erythropoietin, a hormone that normally stimulates red blood cell production. Even if the body has normal levels of erythropoietin, the bone marrow may not respond adequately due to the inflammatory environment. Another important factor is hepcidin, a hormone that regulates iron metabolism. In Ra, hepcidin levels can rise due to inflammation. When hepcidin increases, it binds to ferroportin, which is responsible for exporting iron from cells. This binding leads to the degradation of ferroportin, trapping iron inside cells and limiting its availability for red blood cell production. Even if the body has enough iron stored, it may not be accessible for making new red blood cells, contributing to anemia. Moreover, the red blood cells themselves can play a role in the immune response. Microparticles derived from red blood cells can influence immune cell behavior, potentially worsening inflammation and impacting red blood cell survival. Ra can also lead to a shortened lifespan for red blood cells. Inflammatory conditions can increase their destruction, adding to the anemia caused by reduced production. Managing anemia in Ra involves addressing the underlying inflammation. Disease-modifying treatments can help control inflammation, which often improves anemia by lowering cytokine levels and normalizing iron metabolism. If iron deficiency is present, iron supplementation may be necessary. In some cases, erythropoiesis-stimulating agents might be used, but the focus should always be on treating the inflammation first. In summary, rheumatoid arthritis affects red blood cell production primarily through inflammatory cytokines that disrupt bone marrow function and iron availability. This leads to anemia of chronic disease, which is typically mild to moderate and characterized by normal-sized red blood cells with normal hemoglobin content. Understanding this connection is crucial for effectively managing both Ra and its complications. Always consult with healthcare professionals for personalized advice and treatment options.